Over the last 10 years or so, a number of us have actually done a lot of research and writing, and we've developed a model which really takes into account an evidence base that has been largely neglected by American psychiatry, which really shows that medication outcomes are profoundly affected by all sorts of kind of non-biological factors. So for example, and especially antidepressants. So for example, an antidepressant works better if you have a good alliance with your doctor. I watched the subjectivity of the patient getting dropped out everywhere. It was all about neurotransmitters and medications, and to me, I think this whole enterprise is based ultimately on human relations. We know, for example, that around medications, that the quality of the doctor-patient relationship can make a huge difference in whether medications work or not. And this is the kind of thing that got dropped out of, I think, American psychiatry at a time when there was a lot of focus on, on kind of pharmacologic treatment. And then actually, in many ways, has really only gotten worse over the last decade and a half. And I think it's only really in the last year or two that psychiatry is starting to see that that things have gotten a bit lopsided in terms of our focus on biology. And so what I'm hearing here and there is an increasing awareness of things like meaning in relation to medication, the doctor-patient relationship. One of the things that brought me to Riggs was an interest in understanding people. I think the other obvious thing is that there really is almost nowhere where you can have this kind of close, meaningful, intimate work with people that you really see results. I mean, certainly hospital treatment has changed a lot in the last 2 decades. People used to be able to stay in hospitals often long enough that they might get better. And hospitals have largely given up, I think, that goal, and they're much more focused now on crisis stabilization and moving people out into treatments. But in most cases, there was something awry that left that person needing the hospital in the first place. At Riggs, I think the focus is on making helping the patients make the kinds of deep changes that would mean that they won't need the same kind of treatment. Although many of our patients will go on to have therapy for quite some time, but there's a chance to do work here that really changes people.